unable to talk, banging their heads on the wall, screaming uncontrollably, hitting their tummies. All of these symptoms of autism can frequently be improved significantly with the proper medical treatment. Today, I'm going to tell you why autism has its roots in digestion and how medical treatment can bring about significant improvement in behavior. I'm Dr. Taketa-Wong, founder of Dr. Taketa-Wong and Associates, where patients are empowered with their health. 14 years ago, I decided I needed to lead the way in educating the community on myths and misinformation about autism. Because in children with autism, there are always, yes, always, some medical conditions that are behind the problematic behaviors. Those behaviors have a cause. They don't come from nowhere. At the time, the notion had not been well accepted by the conventional medical community. But cutting-edge science showed that imbalances in the gut microbiome were connected to autism. Today, I'm happy to report that all the studies of the past 20 plus years have served to validate that relationship. That's why the medical treatment I do for children with autism and other special needs is often centered around digestion. Digestive issues are very common in autism. We're talking about 70%. Very rare that I see a child with autism who doesn't have one or more digestive problems. Those digestive problems in children with autism are often a major underlying cause of their behavioral problems. As I am fond of telling my patients, the notion that we are made up of parts is misguided. The body is a single organism. Everything is connected to and affects everything else. Our body isn't just individual parts. It's not just pieced together like a machine. It has features. So for example, problems with the gut bacteria can affect the neurotransmitters in our brain that alter our moods. As you'll see from this talk, that is definitely the case with autism. So let's begin with some of the digestive symptoms that we commonly see in children with autism. And one thing before I get into the rest of it is I do want to preface that there certainly are children that don't have any kinds of specific digestive symptoms, but just because they don't have symptoms, it doesn't necessarily mean that they don't also have digestive problems. Because I've seen children where they have food sensitivities, silent acid reflux, other things that actually are going on in their digestive system, even without any specific symptoms. And it really is a careful history and thorough testing that will help to uncover those kinds of imbalances. But we're going to start with the symptoms that we can see, digestive symptoms. Now let's begin with constipation. There are many things that cause constipation in children with autism. This is probably the most common digestive symptom that I see among children with autism. There can be many causes, such as thyroid problems, poor diet, like picky eating, not eating enough fruits and veggies, not drinking enough water. It can also be attributed to things like yeast overgrowth, small intestinal bacterial overgrowth, food allergies or sensitivities, just to name a few. Kids with autism to eat well. Also, a lot of these kids don't drink enough water. Sensory issues can cause problems with smells or tastes. Constipation can definitely lead to aggressive behavior towards themselves or others. I've treated children who are banging their head, biting themselves, hitting their stomach or other areas of their body, having meltdowns. And when we fixed their constipation, the behaviors improved or resolved altogether. Gluten and dairy are the two most common foods that I see in children with autism that can cause constipation. Why is that? There are peptides in dairy and gluten that are structurally similar to opiate molecules. And what is one side effect of opiates? Constipation. So why doesn't it happen with everyone who eats gluten and dairy? Most people have the enzymes that they need to break down these peptides, which is pieces of protein. One of the major differences in many children with autism is that they often don't make the enzyme or they don't make enough of it. If it's not broken down, it can cause constipation. It's important to note that this is different from lactose intolerance, which often causes the opposite reaction with diarrhea. This is an issue with peptides, not lactose, which is the milk sugar. My treatment protocols including diagnosing medical problems, improving the diet, making sure they drink enough water, and taking out foods that can be causing the constipation. Specific probiotics can also be very helpful. In addition, I sometimes recommend magnesium to soften the stool and adding chia seeds to their food. Acid reflux is another symptom that is very common in children with autism and can also cause behavioral problems. Autism often causes delays and other problems with language and communication. In both constipation and acid reflux, a child may not be able to say, "my tummy hurts," or "my throat hurts," out in their behavior. For example, they might bang their stomach really hard with their fist or burst out in painful crying for no clear reason. Sometimes the child doesn't like to lie down because when they do, the acid can reflux back up and they can feel more pain in their throat. This can cause trouble napping or falling asleep, which often only makes them more irritable and prone to acting out. For short-term treatment, I may prescribe an acid blocker to see if it makes a difference in behavior. If it's a really bad case, a specialist can do an endoscopy, which is putting a tube down the throat, but it does require sedation. If a child does have acid reflux, we need to take out the common triggering foods from their diet. Tomatoes, citrus fruits, greasy and fried foods, at least in large quantities. Sometimes chocolate can be a trigger for acid reflux as well. Besides the acid reflux foods, if the child is still having the problem, we should test for food allergies and sensitivities. Another possibility, though rare, is yeast overgrowth in the esophagus. The important takeaway is to remember that behavioral issues in autism are often directly connected to digestive problems, and when those are resolved, so does the behavior. For those who are new to our events, I'm a naturopathic physician, or ND. Like medical doctors, I, as well as our associates, attended a 4-year medical school, and we are trained as primary care physicians. We order lab tests, write prescriptions, and do school physicals, the same as any other doctor. But with naturopathic medicine, there is much more because we NDs are trained to place nutrition at the forefront of diagnosis and treatment. This is especially true when it comes to pharmaceutical medications, which we prefer to avoid in favor of more natural remedies that are just as effective, if not more so. In addition, we are trained in acupuncture and Chinese medicine, which gives us 2 additional and powerful natural medicine tools. If you have a health condition that you would like to talk with me about, please call our office and schedule a free phone consultation. All of the contact information is on our page. Intestinal yeast overgrowth is not well known, but it is not uncommon in autism. Fungal skin, mouth, or toenail infections are signs that intestinal yeast overgrowth may be present, but you don't need to have these things to have an intestinal yeast. Or diarrhea may also be signs. Sometimes the only symptom is aggressive behavior, where the child is injuring themselves or others. Another symptom is excessive stimming or laughing episodes. For example, waking up in the middle of the night and laughing or cackling, sometimes for a long time with no clear reason, out of nowhere, especially if it's prolonged. There also may be crying episodes out of the middle of nowhere. Treatment typically involves an oral antifungal medicine, either pharmaceuticals or herbs. Also, yeast feeds on sugar, so it's also important to take refined white sugar out of the child's diet. So things like cookies, candy, soda, and so on. Small intestinal bacterial overgrowth, or SIBO, can also cause problem behaviors. Because the test involves blowing into a tube several times over 3 hours, most children with autism are not able to complete the test. So I look for symptoms such as gas, bloating, signs of abdominal pain, constipation, diarrhea. Some children can say their tummy hurts. Others can't, and they may be pressing against their tummy. The treatment is to work up to a SIBO diet with foods that don't feed the bad bacteria and giving herbal remedies or pharmaceuticals to kill the bacterial overgrowth. Diarrhea is another common problem in children with autism. With diarrhea, we consider things like small intestinal bacterial overgrowth, parasites, yeast overgrowth, and sensitivities. Treatment can be food changes and antiparasitics and antifungals. Abdominal pain is often reported, or there could be signs of abdominal pain. This includes the child pressing against their tummy, against furniture or other items such as a table or chairs or the sofa or a bed. They also may be hitting their tummy. They may also be curling up into a ball and going into. So these can all be signs of abdominal pain if a child is not able to say verbally, "My tummy hurts." These can be related to food sensitivities, food allergies, and all of the above conditions that I mentioned earlier. Colitis is another condition we see. It's inflammation of the large intestine. Colitis is not as common, but if there is severe aggressive or self-injurious behavior, it should be screened for. It also should be screened if there is blood or mucus present in the stool. If it's serious, it may need to be treated with drugs, but often natural remedies and changing the diet can really help. All of these conditions can cause feeding difficulties. If a child isn't feeling well, they may not want to eat, or they may only want to eat certain foods. This condition can be connected to sensory issues as well. With the picky eating, with sensory issues, the problems typically are related to inflammation with the brain. A blood test can reveal if there are high markers for neurological inflammation. As we treat it and get it better, the sensory issues typically improve. If there is inflammation in the gut, the research shows that it can contribute to brain inflammation and vice versa. The big take-home message for today's presentation is that digestive issues are present in nearly all children with autism. When corrected, I've seen definite improvement in behavior, sometimes dramatically. I've also seen improvement in some children with things like awareness and even language. I trust that this talk has been useful for you. I'd certainly welcome the opportunity to discuss your specific health condition so that you too can be empowered with your health. To do so, just call or text our office to schedule a free phone consultation with me. There's no charge because we don't take patients without talking to them first. We always want to make sure that what we do fits your needs. You'll find all the contact information on our Facebook page. Mahalo, and we look forward to seeing you in 2 weeks. Aloha.